Its practicum was with Vancouver Island Health Authority, commonly known as Island Health. My presentation is about comprehensive school health and an evaluation of the public health professional role. And I'd love to share more experiences with you, but like Jane Austen's quote, time does not permit. So we carry on. This is the geography covered by Island Health. North of Victoria, communities become smaller, more rural and remote. Numbers of First Nations communities increase from south to central to North Island. In May 2011, the BC Ministry of Health launched Healthy Families BC, a chronic disease prevention and improvement strategy. A key initiative is Healthy Schools BC. A goal is to build capacity of the health and education sectors to use a comprehensive school health approach in creating healthy school communities. This means initiatives that consider the whole school community, and the whole child. The premise being healthy students are better learners. For public health professionals, it requires a role redefinition from being task-oriented on narrowly focused health protection and promotion activities to being the catalyst or change agent, bringing different groups and mandated agencies within the community together. For example, working with school personnel, student representatives, and parents to develop strategies that encourage school-wide practice of serving healthy treats rather than thickly iced cupcakes for in-school celebrations. These are some of the public health professionals who work with school communities. Now, hopefully this gives you a sense of the complexity of launching a program that involves change in perceptions of health and how to address health issues among multi-organization, intersectoral, multi-ethnic, interprofessional systems. For my practicum, I joined a group of Island Health public health professionals who are working on a broad evaluation of the Healthy Schools BC initiative. I will refer to them as stakeholders and to public health professionals as PHPs. My project focus was narrower. Today, I will speak about the proposed plan to monitor public health professionals' progress with role redefinition. In effect, a process evaluation, an early check to see if all essential elements are in place and operating. A literature review helped gain an understanding of potential barriers and facilitators and the extent of their influence in role redefinition. The social cognitive theory helps inform strategies to address role redefinition capacity. Its central tenet, self-efficacy, is the key factor in implementation of complex organizational change. Evaluation design is mixed methods. Knowledge and skills levels, as well as a sense of confidence and competence, will be evaluated. The target population is less than 120 PHPs. All will be invited to participate. Stakeholders felt responses would be more candid if workplace location wasn't requested, cognizant that subgroup information could be useful in determining local needs. Iterative development of 2 data collection tools addressed ease of use and time burden to complete each tool. Pilot testing will be done by volunteer PHPs from different regions of Island Health to ensure each captures local issues and measures what it is intended to measure. The online survey tool, formatted into fluid surveys, will be used at the end of each school year. Most questions are closed-ended, but include opportunities for expression of attitudes and opinions. According to Paget, in process evaluation, qualitative data shed light on how implementation is progressing from an insider point of view. The competency assessment tool is for PHPs to assess individual proficiency levels of ability and knowledge using a 4-point continuum. Competency statements are contextualized to represent knowledge and skills required for comprehensive school health work. For the online survey, suggestions to increase participant response include advanced communication with 2 reminders during the survey run. A 75 to 80% response rate is recommended. For quantitative data analysis, descriptive statistics, and univariate analysis, data presentation can be in a variety of tables or graphs for greatest clarity of variable comparisons. For qualitative data, content analysis, ideally done by more than one person to decrease bias potential. Table format can display frequency of themes and include examples of participants' responses, protection of privacy being particularly important. The competency assessment tool can be used by PHPs at any time. If used as part of a comprehensive annual evaluation, improved validity of findings could be achieved through triangulation. Data analysis for this tool, straightforward. Individuals identify their own priority learning needs. Group learning needs are determined either at local or island health-wide levels. Ongoing evaluation will measure collective progress with role redefinition, as well as inform need for revising training and resources and for modifying program implementation. It will be important to include opportunities for PHPs to discuss and reflect on evaluation results. Ethical issues. To identify and understand challenges of working in remote regions, PHP's privacy may have to be balanced with need to collect subgroup data. Support and equitable resource allocation is for the benefit of PHPs and consequently for the populations they serve. Challenges and strengths. Although stakeholders' limited time precluded much feedback on draft data collection tools, comments received provided insight into making adjustments. I was fortunate to have a mentor experienced in program evaluation. Changes in membership and roles provided glimpses into the reality of conducting evaluation projects in complex systems and the need to be flexible, adaptable, and responsive to changes in group dynamics. Design strengths. Qualitative data may provide enlightening information about PHP's experiences. Reminders and encouragement may assist in increasing survey response rates and data credibility. If perceived as supportive, reminders could also increase use of the competency assessment tool. Additionally, incentive tokens, if used, could be perceived as organizational support. Discussion and reflection on evaluation results can facilitate buy-in for an integrated evaluation/quality improvement process and enhance PHP's role redefinition capacity. Design limitations. For the online survey, there is potential for compromised response rates, limitation to qualitative data analysis, and missing local data. The competency assessment tool could take up to 30 minutes to complete. That might be an impediment to its use, as well as the initial unfamiliarity with competency language. 2 implications for public health practice. The first is the integrated quality improvement process, measurements at multiple time points, important because public health programs are complex and can take a long time to get established, and implementation of change unfolds and can deteriorate over time. Thus, if you've got a quality improvement process, facilitates quick response to learning needs, ensures that educational opportunities and resources are consistent with moving towards the program goal, and determining where and when adjustments in program delivery are required. The second is use of core competencies. In conclusion, role clarity and ability to describe scope of practice are vitally important to avoid confusion and misunderstandings of responsibility among health, education, and larger community sectors. Appreciation and thanks to many people. Dr. Fife, thank you so much, and Anthea, mentor extraordinaire, and my home team. So thanks so much. Questions?
Thank you, Kathy. I have the mic. Who has questions? People are thinking, oh.
Great job, Kathy. As a public health nurse over in Vancouver, I understand with the comprehensive school health model being rolled out, and provincially they're looking at how it's being adapted and being rolled out. I'm just wondering if there's any opportunity to share the work that you've done provincially for the evaluation.
Provincially?
Yeah.
I'm not sure exactly what's being done provincially. My understanding is that many health authorities have got sort of evaluation processes happening, but I don't feel that I can speak to what's happening provincially. You're Kristen, right? Yeah. Thanks for the question.
Other questions?
Hi, Kathy. Thanks for the presentation. I was just wondering if you have incorporated any consultation with the public health professionals that will be doing these, this training to see what sorts of training methods and delivery methods would work best for them.
That's part of the evaluation tools, so thank you for that question. And it's looking at what sort of approaches might be most suitable. And that could certainly vary whether you are in Victoria or whether you're in Port Hardy or whether you are in some of the remote communities. Because travel to get to, if you had a sort of a regional or an island-wide kind of education opportunity, the travel from those remote regions is a big issue. Yeah. Does that answer your question? Yes. Yeah, great. Yeah.
Anyone else? Well, I'll take the opportunity since I have the mic. Haha. I mean, it's meant as a friendly question and a reflection, I think, on the work that all of you have done, because as Lynn alluded to earlier, we have limited time in our 13 weeks in 506, that's the research methods course for the MPH students, to cover all the ground I would like to cover. So we smush it all in. And many of you pick up, particularly on the 4th assignment, which is the program eval assignment, and read widely and deeply. And I guess, Kathy, given your experience this term with this project, any reflections on sort of your key takeaways in terms of, how should I frame this? Like the top 3 things you would tell someone learning program evaluation about doing or planning program evaluation?
Well, first of all, gee, I don't know if I can name 3 right off the top, standing up here.
2, 1, whatever, make a list.
Well, I found for myself, first of all, I really had to wrap my head around the process. And I was looking for, just give me the A to Z and I'll follow it along. And it's not A to Z. It kind of, for different organizations, for different situations, it seems to be you can go from A to C, you might miss out on A, you might start at C and go to E and then jump to M. So there's no sort of process. It's almost like you have to, and that's why I was so happy to have somebody who was familiar with program evaluation, because then we sort of talked the same language, and I would pick up on something she said and try to put it into this framework that I thought this evaluation should be around. Well, I realized, gosh, I don't think there's a definite framework here other than this very broad kind of process that you use. And I think it was the same for her because she was working from a slightly different framework. So we would compare where we were at. And that this language meant this, and this language meant that. So not only, I guess with organizations and doing evaluation, not only are you working with the language of those particular organizations like Maria alluded to, but you're also working with some of the language around evaluation. Yeah, that's for me was one of the big takeaways.
Yeah, thanks so much.
It was great. So what can I say?
Thank you very much, Kathy.
Thank you.